One of the things about a breast lift that's most important for people to know is that a breast lift obviously lifts the breast, takes a nipple that's lower, puts it into the center of the breast, and then removes the extra skin. And I think the key thing for people to know is that it never looks like an implant. It doesn't create the roundness of an implant. But that's not to say that an implant looks best. So it's whatever somebody's taste is. If they have the taste that they like, a rounder, more full upper look, great. That's probably an implant with their breast lift. But many people don't want that for one reason or another. And I tell people, I think a beautiful breast that has a beautiful shape, I don't care, this is my own opinion. So I don't care what size that breast is. It's beautiful. It could be A, B, C, D, whatever. So as long as they understand what a breast lift truly looks like, then that, of course, that's what I offer. And so I came up with a way of, and again, I can't speak for every surgeon. I'm not trying to speak for any other surgeons other than myself, but many breast lifts are lifted only by the skin. So the nipple is moved up, the breast tissue is just kind of pushed up, and then the skin is tightened. But the skin, if the skin could hold a breast, they wouldn't need a breast lift. There would be no sagging. And so I don't think it works very well. It's kind of been a 7-year journey of figuring out how to support the bottom of the breast. And so I figured out a way that works for me to kind of create essentially 3, I call it a triple bra. The name's not very inventive, but essentially I have 3 natural layers of tissue that I've, one, learned from somebody, but then the 2 additionals created or came up with a way to support the bottom of the breast. And so the breast looks more braless. It looks more full compared to a typical breast lift. Many times when I show an after of a breast lift, people wonder if there's an implant there, when in fact there's not, but it's just the extra support that my breast lifts have. And so people are beginning to find me for this operation specifically.